Hello, thank you so much for joining us. My name is Tiffany Garcia. I'm a librarian at the San Jose Public Library. Today we have Evelyn from the County of Santa Clara Behavioral Health Services. Today she will be talking about mental health resources for youth. And we will go ahead and turn the spotlight to Evelyn.
Thank you so much, Tiffany. We really appreciate you allowing us to take this time to let folks know what mental health resources are available for youth in the county. So thank you everyone for joining us today. We appreciate you taking this time. And so we'll just go ahead and get started. All right. So just before we get started, I do want to give a small disclaimer. Today we are going to be going over resources and which resources are appropriate for which risk level. This is not something that we are training you to be able to provide. It's really just to provide you with information so that you feel empowered to help someone who is in a mental health crisis to get them to those appropriate professional help. And so just wanted to let you all know that, while we'll be going over which steps to take, this isn't certifying you to be able to do anything that a clinician would or anything like that. Okay. All right. So here we have what we call the ladder of care. And so at each risk level, there is an appropriate resource provided by the county for that individual at that level of risk. And so here, what you see on the left-hand side is this arrow pointing upward, which is really depicting the level of risk, right? It's increasing, it's going up. And so on the right-hand side, we have a color coordinated chart there from green, yellow to red. And so what we see is that at green, we're at the least level of risk, right? At this point, risk is pretty low. And then as we keep going up that level of risk, we come to yellow and then we come to red, which is really that emergency 911 situation. And so what we'll be doing today is going along this ladder and looking at what resources are available for youth in the county, depending on the level of risk. Okay, perfect. So here we're at that green level where someone is really just thinking about talking to someone. So risk is really very low at this point, and they really just want to be able to access a mental health provider and start to talk, right? And so there are a few resources that we have here. First of all is our mental health referral call center, excuse me. And the phone number is there on the side. And so we, like I mentioned, the mental health referral or call center is that phone number there that you can call. And essentially, this is where you call when you want to speak to a mental health provider in the county. And so a clinician will answer the phone, ask you a few questions, and then they will try and get you an appointment with a mental health provider. Now, specific to youth, because the call center is for all ages, but specific to youth would be Alcove. This is going to be a one-stop shop for all youth, which is actually going to launch sometime this summer. So do keep an ear out about Alcove or look up Alcove online. They should already have their website up. But this is going to launch soon, and it is a very, very exciting in-person resource for pretty much all youth and really at any level of risk, but really it's just going to be, like I mentioned, that one-stop shop. So we're really excited for this to launch. And for LGBTQ youth, we do have the LGBTQ youth space, and that's their, excuse me, that's their phone number there. And so this is specific just for LGBTQ youth in Santa Clara County. They do have a physical location as well, but I would recommend calling so that you can set up an appointment, especially now with COVID and everything. Sometimes they're in the office, sometimes not. All right. So let's say that now we're going up that risk level, right? We're moving down that ladder of care. And so, or moving up that ladder of care. And so now someone is starting to feel, a little bit more um, depressed, or, feeling a bit, their emotions are a bit irregular. And so now they feel like they really need to talk to someone right away. And so we definitely have those options, because um, with oops, sorry, with these options here, it does take some time to get your first appointment, right? Sometimes a month, sometimes more. And that's why we give out these resources when risk is very low. But now that we're, moving up that ladder of care, and someone does feel that they don't have a month to wait, they really want to talk to someone right away. These are the resources that we have. And so for all ages, we do have a suicide and crisis hotline that is Santa Clara County specific. So that's really important, because the counselors that answer the phone are going to be far more knowledgeable of local resources than another hotline, let's say like the national line or anything like that. And so this number is available 24/7. And we do have contract services with language providers. And so if someone on staff doesn't speak the language, we can get, essentially, it's like a three-way call where a translator is provided. And so for the hotline, we really love it because it's 24/7, any language, any age. And it is our hotline here in Santa Clara County. We also know that for youth specifically, they prefer not to call. They want to text. And so we have those options available for them as well. And so they have our county line is they could send the code word renew to 741-741, and they would access the same kind of counseling as the hotline. The only difference is that they are texting out those responses instead of actually talking on the phone. And so we find that youth really appreciate this resource. And the crisis text line is also 24/7. Unfortunately, for now, they are working on it, but for now it is in English only, the crisis text line. However, we also have a teen text line. And so the crisis text line is for all ages, but specific for teens, they would send the code word teen to 839-863. And you'll note that it's only available from 6 to 9 p.m. There's a very good reason for that. And this is why we love the teen text line. It is actually teens talking to teens. So this is actually a peer-led text line. And so that's why of the limited hours there, of course. And so we really love this one because, it can be scary to talk to an adult, and so now we're lowering, those barriers. They can talk to a peer, someone who understands what they're going through, and it's via text. They don't even have to call. So it's completely anonymous. So it's important to note that one. Now, for our LGBTQ community youth, we do have the Bill Wilson Center Safe Place Crisis Line. And again, this is specific to LGBTQ youth. And also our Trevor Lifeline. Trevor is actually a national resource, but it is pretty much the gold standard in terms of hotlines for LGBTQ youth. And so I always like to include that one as well. The Bill Wilson Center one is local, Santa Clara County, and the Trevor Lifeline is at the national level. Okay. So now again, we're moving up that ladder of care, right? So now this is someone who needs to actually see a mental health provider right away. We've moved past, the phone, talking on the phone and, crisis hotlines and things like that. Now they need to actually get services. And so for someone who's at this level, in the county, we have mental health urgent care walk-in clinic. And so this is a clinic specific to someone who is seeking a mental health treatment. And so you're not going to find someone with the flu or a sprained ankle here. This is specific to someone who needs to talk to a mental health provider right away. Um, this one here is at 871 Enborg Court in San Jose. And they do say that they have hours of service. However, I hope I don't get in trouble. But they do have a at the door, if it's closed, if it's after hours, on the right hand side, there's going to be a doorbell. If you ring that doorbell, someone is going to come and open the door. So even though they technically have, a 9 to 5 situation, if you do find yourself after hours, you can ring that doorbell and someone will help you. Um, don't tell them I told you. Okay, so moving on. And this one is for all ages. So what I would actually recommend, highly, highly recommend if you're at that situation, um, and you need that help right away, is actually to call a mobile health crisis mobile unit. And so the one that we have in Santa Clara County, again, specific to youth, is called Uplift Family Services, and that's their phone number there. What I love about Uplift is that when you call, you don't speak to a receptionist, you don't speak to a machine, you speak to a clinician, to someone who actually has the skills to be able to de escalate the situation over the phone. And if necessary, that clinician will hop in a car and drive out to wherever that youth is in Santa Clara County. Okay. And what they're going to do when they arrive on site is they're going to assess them for hospitalization. And so if they find that the child does need to be hospitalized, what they will then do is another really amazing thing. Instead of taking them to a unit that's all mixed, they will actually take them to a specific place that is for youth only. And so that's going to be far less traumatizing than getting like hospitalized in the hospital. It's I've seen the facility. It's very nice, very open. It doesn't have that scary lockdown feel to it. And so it's very family friendly, very youth friendly, open, airy spaces, things like that that are very important for someone who is going through a crisis. And so we really want to make sure pretty much that everyone, and especially parents or caregivers, know that Uplift Family Services exists. Because if you do find yourself in some kind of mental health crisis, you can call this number and talk to a clinician right away. And like I mentioned, they will drive out to where you are. Okay, so lastly, now we're here at the red, right? So now we're in an actual emergency situation. So what do we classify as an emergency? That's if someone is actively suicidal, if they have some kind of a weapon, or if they're somewhere where it is unsafe to reach them. Once safety starts to become part of the equation, that's when that's an emergency, and we do find ourselves having to call 911. Of course, we want to avoid calling 911 as much as we can, but those situations do come up. And so if you find yourself having to call emergency services, then we do ask that you ask for a CIT officer. That stands for Crisis Intervention Team. And so this officer has received an additional 40 hours of training than the regular police force, specifically on how to engage someone with a mental illness. And so they understand that if someone is having hallucinations or auditory hallucinations, that person is not going to be as compliant. And so they go through lots of training. It's a very intensive training. Like I mentioned, it's 40 hours. And so it's specific on how to handle this type of crises. And so it is essential that if you do find yourself having to call 911, that you ask for that CIT officer. Again, that's Crisis Intervention Team. And that pretty much concludes the ladder of care and the type of resources that we have. Thank you so much, Tiffany. We really appreciate you allowing us to take this time to let folks know what mental health resources are available for youth in the county.
Thank you for joining me in the Sounds Like Public Library. Please take a few minutes to fill out our program survey. For a complete list of other virtual programs, please visit sjpl.org/virtual programs. Also, don't forget to follow us at San Jose Library on Facebook and sign up for their newsletter at sjpl.org/e-newsletter to stay informed of all things SJPL. Have a great day.